In the fight against the deadliest infectious diseases, HIV, TB, and malaria, this is a moment of reckoning. Over the last 2 decades, we've achieved extraordinary progress, led by implementer governments and communities themselves, backed by the global community through generous support of the Global Fund. Reducing the burden of HIV, TB, and malaria has had a transformational impact on the lives of billions, enabling them to live longer, healthier, and happier lives. Nowhere has this impact been more dramatic than here in Africa. Yet right now, our collective ability to sustain this astonishing story of saving lives and improving well-being looks in jeopardy. Will partners continue to provide the level of financial support required? Will implementing governments step up to take leadership and financial responsibility as much and as fast as is needed? Can they? The Global Fund's 8th replenishment will be a big part of the world's answer to these questions. A successful replenishment will drive continued progress against the 3 diseases and in building stronger health systems, will create a feasible pathway to nationally led and financed health services, and will ensure that no one is left behind as we work through these transitions and simultaneously navigate the challenges of climate change, conflict, and economic turbulence. The Global Fund Partnership is a proven model for turning donor dollars into impact at scale. Combining local leadership with global expertise, the passion and knowledge of communities with the agility of the private sector, the power of governments with the reach of civil society. This unique partnership is unequaled in its efficiency, effectiveness, and adaptability. Together, we have saved 65 million lives and reduced the combined mortality rate from HIV, TB, and malaria by 63% since 2002. These are not abstract numbers. They mean healthy parents able to work and look after their families. They mean children sleeping safely under bed nets, able to grow, learn, and thrive. Take Zambia as an example. Life expectancy in Zambia soared from just 43 years in 2002 to 58 years in 2021. To gain 15 years in life expectancy in just 19 is astonishing. Over 2/3 of that extraordinary gain comes from reducing deaths from AIDS, TB, and malaria. Despite the challenges, COVID-19, economic stress, escalating conflicts, the ever more evident impact of climate change, and in too many places, an erosion of human rights and a stalling of progress on gender equality, we have continued to advance against HIV, TB, and malaria. And we're not just saving lives, we're strengthening health systems, improving livelihoods, and bolstering global health security. The SDG 3 target of ending AIDS, TB, and malaria as public health threats by 2030 is within sight. Yet seeing the goal is not the same as attaining it. Our gains are fragile. HIV, TB, and malaria are formidable adversaries that are quick to punish any dilution of effort. Ultimately, we must get to a point where countries have reduced the burden of the 3 diseases, strengthened their health systems, and increased their own spending to such an extent that they can finish the fight without further external support. But we're not there yet. The path to sustainably financed national systems, no longer reliant on external funding, is exactly that, a pathway, not a switch. While some countries can and should do more now, for others, particularly the poorest and those afflicted by conflict, the path will be longer and more challenging. Too abrupt a transition will derail progress, leave millions behind, and cost millions of lives. A successful replenishment will enable the Global Fund to play our role in sustaining progress against the three diseases while simultaneously incentivizing and enabling the shift to nationally led and financed systems. To deliver on the Global Fund strategy targets for 2028 and to ensure we keep the SDG 3 targets within reach, we need to raise $18 billion for the Global Fund's next 3-year grant cycle. Why $18 billion? The answer is in this chart, which shows different trajectories for the combined mortality rate for the three diseases. The black line indicates our progress to date. The orange line represents the trajectory laid out in the global plans for HIV, TB, and malaria. As you can see, we are already off track. The 3 dots represent the Global Fund's low, medium, and high impact targets for 2028 set out in our board-approved strategy. The dotted pink line at the top shows what will happen if we simply keep doing what we're doing. With $18 billion, we could achieve and sustain the trajectory marked by the turquoise line, protecting our gains and accelerating progress. Most importantly, with this level of resources, we could save 23 million lives between 2027 and 2029. We could reduce the combined mortality rate by 64% relative to 2023, and we could prevent around 400 million infections. It took the world 18 years to halve the combined death toll from AIDS, TB, and malaria. With the right resources, we can more than halve it again in only 6. Every life lost is one too many. But to be able to reduce the death toll from AIDS, TB, and malaria from 2.3 million in 2023 to under 1 million in 2029 would be an immense achievement. With a successful replenishment, we could make the most of biomedical innovations to accelerate progress against the three diseases. We could invest in critical infrastructure and capacities to deliver life-saving services. We could stimulate domestic funding for health and help countries make better use of such resources. We could better prepare for future health threats, make faster progress on the path towards universal health coverage, and build stronger, healthier, and more economically productive communities, helping to create a more just, peaceful, and stable world. That's the scale of the prize. Take HIV. If we act decisively and together, we could reduce AIDS-related deaths by 59% by 2029 and cut new HIV infections by 66%. This would take us within reach to touching the SDG 3 target of ending HIV as a public health threat by 2030. Think about that. Ending HIV/AIDS, a pandemic that has killed more than 42 million people, would be an extraordinary achievement, a milestone in human history. Innovations will be crucial. By deploying new prevention tools, such as long-acting injectable PrEP, we could radically reduce new infections. Accelerating the fight against HIV will save lives and save money. Preventing a 20-year-old from being infected with HIV means avoiding 50 years or so of antiretroviral treatment. TB is now the deadliest infectious disease in the world, claiming 1.25 million lives every year. As the chart shows, ending TB as a pandemic by 2030 will be very challenging, but we could get close by 2035. Deaths from TB have dropped by 40% in the past 2 decades, but new infections remain stubbornly high. With a successful replenishment, the Global Fund partnership could reduce new TB cases by 26% and cut TB deaths by more than half. TB programs have rebounded from the disruption of COVID-19 and are now delivering record results, with more people with TB found and treated than ever before. We must sustain this momentum, taking advantage of price reductions achieved through market shaping and leveraging the potential of new diagnostic, prevention, and treatment tools. Over the last 2 decades, we've cut malaria deaths by 29%, even though the population in these countries has increased by 42%. But far too many children are still dying of this preventable disease. Progress has stalled, and right now, the path to ending malaria by 2030 or even 2035 looks daunting. In fact, since 2015, malaria cases have begun to rise again in some areas, fueled by conflict, climate change, and resistance to insecticides and anti-malarial drugs. Given that the Global Fund is by far the biggest funder of malaria programs, a successful replenishment is absolutely essential to regaining momentum and preventing the deaths of so many children and pregnant women. We have the tools, and the pipeline of innovations is extraordinarily exciting. But right now, we're not deploying these tools at the intensity and scale required to achieve a decisive reduction in transmission in high-burden areas. With the right level of investment, we could achieve that breakthrough, cutting malaria deaths by 65% by 2029 and the number of cases by 57%. It can be done. Every year, more countries are certified as being malaria-free. By investing at scale and by optimizing the deployment of tools, we can reverse the setbacks and dramatically accelerate progress. In a volatile world confronted by colliding crises, the Global Fund's agility and responsiveness saves lives. Whether it's COVID-19, outbreaks like Mpox, war, or extreme weather events like flooding or cyclones, we act with speed to support countries responding to crises. Yet the lives we save and our progress against the 3 diseases are only part of the story. Our efforts to combat HIV, TB, and malaria, including our investments to strengthen health and community systems, and our work to tackle human rights and gender-related barriers to access, have significantly advanced universal health coverage, often known as UHC. Indeed, 70% of the improvement in the global metric on UHC is attributable to progress against the 3 diseases. And through our focus on dismantling barriers to access, the Global Fund Partnership plays a unique role in ensuring the U in UHC is not just rhetoric. Reducing the burden of HIV, TB, and malaria has a significant impact in freeing up health systems' capacity, enabling health workers, hospitals, and clinics to tackle other health priorities. In the countries where we invest, cumulative health system cost savings from reducing the burden of the 3 diseases amounts to $103 billion. Yet go somewhere like northern Nigeria or Chad, you'll find every hospital and clinic still overwhelmed by malaria cases. In the highest burden regions, reducing the malaria burden is the fastest, most cost-effective way to increase health system capacity. And that's on top of the lives that are being saved. As the largest multilateral investor in health systems, we're right now enabling a massive expansion in medical oxygen capacity, strengthening community health worker networks, upgrading laboratory infrastructure, expanding disease surveillance systems, and reinforcing supply chains. The impact of these investments goes far beyond the 3 diseases and significantly strengthens health security. Investing in the fight against HIV, TB, and malaria also increases economic productivity. The $63 billion the Global Fund has invested over the last 2 decades has generated $1.2 trillion in economic value from better health outcomes, plus $400 billion in direct productivity gains. As an ex-banker, I can tell you that's a phenomenal return on investment. As a mechanism for translating donor dollars into impact at scale, the Global Fund is hard to beat. We're demonstrably efficient and effective. Operating expenses are only 6.2% of donor pledges. But we're also never satisfied. That's why we've just launched an offshore IT service center and are constantly looking for ways to improve for synergies with partners. When money is short, we must get the most out of every dollar. Using our scale and market-shaping expertise, we're driving down the prices of life-saving health products and accelerating access to the latest innovations. For HIV, TB, and malaria, for treatments, diagnostics, bed nets, and lab equipment, no one else can do what we do to ensure affordable access to the communities who can benefit the most. We have the opportunity to rid the world of these deadly infectious diseases. We can cut deaths dramatically, prevent hundreds of millions of infections, and accelerate the path to ending these diseases forever. By removing the shadow of these deadly diseases, even the poorest and most marginalized communities will have the opportunity to prosper and thrive. By building stronger and more resilient systems for health, we can make the SDG 3 promise of health and well-being for all a reality. And by strengthening health security for the most vulnerable, we strengthen health security for all. By mobilizing the entire partnership and by being simultaneously ambitious and realistic, we can accelerate the path to nationally led and financed health systems no longer dependent on external funding. We have the tools, the knowledge, and the experience to make this happen. Let us seize this moment, build on and protect what's been achieved, win the fight. This is the moment. This is the time.